Live with Liz, sponsored by TriHealth.
So our weather may not feel like spring yet, but a warmer winter may have spring allergies already blooming. And joining us now to talk through the misery, Dr. Scott Woods of TriHealth Family Medicine. Hello to you. What are you seeing with patients? Are they complaining of allergy symptoms already?
It hasn't quite started yet, but I'm worried that it's going to start really soon. Because similar to last year, things are already, trees are already in full bloom. And last year, I think, was the worst allergic season I've ever seen in 30 years. Lots of chronic upper respiratory tract congestion, lots of rashes, especially eczema.
So we have a little video. This came from the University of Michigan because they said all around the country about half the states are experiencing this kind of jump in allergy symptoms. So I was just curious, everybody wants to know, what do you have new to treat allergies, or what should I know about easing this ache?
Well, it's certainly going to start real soon, and the more allergic you are, obviously it will start even earlier for those individuals. There's a lot of options. A lot of over-the-counter options. The first-generation antihistamines work very well, such as Benadryl. They can be a little sedating, but they're very strong and relieve the symptoms if you don't experience any sedation with that. The second-generation antihistamines, also over-the-counter, drugs such as Claritin, Zyrtec, Allegra, tend to be non-drowsy for most people and also last significantly longer, last a good 24 hours. But probably the best thing you can do, which many people may not be aware of, is spraying steroid nasal spray into the nose. That tends to work better for more moderate to severe symptoms, cooling the symptoms down with topical steroids, such as like a Flonase nasal spray, which is over the counter, but is also available by prescription by your healthcare provider.
Yeah, so I think we need to get to an allergist, but your primary care doctor is a good place to start with this, right?
Yeah, there's not enough allergists in the city anyhow. So, no, this is definitely a primary care issue and can usually be addressed with one or sometimes two medicines. There certainly are a few people who are very allergic and will require multiple therapies.
And then if you have tried these and you're like, man, this isn't going away, do you separate the symptoms to figure out if it's a true sinus infection or what?
Yeah, sometimes it's difficult to actually separate out different types of symptoms. But in general, allergic symptoms will be relatively chronic. They can cause a lot of itchy eyes, itchy roof of the mouth. And if you actually have some of that congestion a little bit lower, like in the trachea and bronchus, you can have a little bit of an allergic cough also. But your healthcare provider would have to probably separate things out to see if you actually have a sinus infection. That's far less common. But allergic congestion certainly can be very chronic and very aggravating.
Yeah, so true. All right, we want to make sure that people have a TriHealth primary care number. If you don't have a provider, they will set you up with one, 513-853-2100. Dr. Woods, thanks for being a voice of education in this community for just a long time. It's been great to work with you.
My pleasure.
All right, the NIT